So welcome back, everyone. I hope you enjoyed our last session, Emotional Impact of Colorectal Cancer on Patients. I'm sure everyone was moved by Samantha's courageous story. I certainly was. So moving to our next session, we will address early age onset of colorectal cancer, which is on the rise in Canada and around the world. In this session, Dr. DeVera, Associate Professor at the University of British Columbia in the Department of Pharmaceutical Science, will share a short presentation regarding some of the research projects she has on the go. Dr. DeVera was an early age onset patient herself, having been diagnosed 5 years ago when she was 36 years of age. Following Dr. DeVera's presentation, we'll be joined by Pierre Campeau, Dylan Fournier, Bryna Dilman, and Haydn Bechthold, all cancer patients, to have a discussion. We will ask them to introduce themselves at the start of our panel discussion. So each story is remarkable, and I cannot tell you how much I admire and respect each and every one who agree to join our panel discussion today to share their personal journeys. This is very valuable. So we will conclude the session with an opportunity for the audience to ask a few questions. I remind you that if you want to capture your question while the presentation is going, you can just use your question button at the top right of your screen, and we'll answer them when we get to the Q&A. So I'll pass to Dr. DeVera to start the session.
Thank you, Dominique, for the introduction. And I am honored and panel on, I believe this is the first colorectal cancer community conference, and I really appreciate the invitation and the opportunity to be here. So I am broadcasting from my home in Vancouver. So I want to take pause to acknowledge that this is on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And wherever you are, where you're joining us from, I invite you to recognize the land and the people that you're on. So with that, this session is about early age onset colorectal cancer. I don't think I have to convince people how common colorectal cancer is. It is the third most common cancer in Canada. And in 2020, there were 26,900 cases new colorectal cancer. So it has historically been considered a disease among older adults, particularly over the age of 50 years. And that's why we see a lot of population screening approaches starting at age 50 years. But in recent years, particularly in the last 10 years and more recently in the last 5 years, we've seen some alarming evidence on the increasing evidence of early age onset colorectal cancer that is diagnosed among adults less than 50 years. And I'm actually one of those adults. So in 2016, at the age of 36, and when I was actually 8 months postpartum, I had just given birth to my second child, I was diagnosed with stage 3B rectal cancer. And I just did a little map of what the journey looked like while I was going through. So I had 5 weeks of chemoradiation, and then I had surgery, lower anterior resection with an ileostomy, which was followed by 4 months or 8 cycles of FOLFOX chemotherapy. And then I had an ileostomy reversal surgery. So I am fortunate to be 5 years with no evidence of disease. So I'm still undergoing surveillance. I'm fortunate to be here to be sharing this experience. So before I was diagnosed with colorectal cancer, I had actually just started a position as an assistant professor and a researcher because I'm actually an epidemiologist. So it was really hard to turn off that researcher scientist mind as I was going through my treatment, particularly when I would go to the cancer Cooper and notice a lot of people there who were much older than me. Like there was no one that looked like me in the waiting room. So it's hard to turn off the epidemiologist's mind, because epidemiologists, we study patterns of disease. And this has got me asking to, what are the gaps in this area and where could I potentially contribute to? So one of the things I didn't do when I was diagnosed was Google my own disease. But what I did do was write down a lot of questions that an epidemiologist would ask. So this is just a spectrum of cancer research from the US National Cancer Institutes. So it kind of breaks down in the most simple sense what cancer research tries to do. So there's basic research, which is going to be the research that will identify the causes of cancer so that we can cure it. Clinical research is what evaluates treatments. And it's really exciting, actually, in the last recent years, where treatment for colorectal. Translational research is that intersection between basic research and clinical research. And where I fall is actually population research, where this is where we can address issues in survivorship, in psycho-oncology, and in health outcomes. So essentially where I position is, once a person has been diagnosed with cancer, how can research improve kind of how they'll journey through that, like as they experience the other aspects of cancer, like the impacts on sexual health, reproductive health, mental health, looking at their information needs. So when I went back to work, so after I completed treatment, I went back to work and I actually sought to start a research program on early age colorectal cancer. And my goal was actually to use research to raise awareness about early cancer, because at that time, again, we were seeing that the risk was rising, but it was still underserved in terms of research, underserved in terms of like the supports that patients were getting. And I thought I was in a position as a patient and a researcher to use what I know, both as a researcher and as a patient, to raise awareness about this disease that has profoundly impacted my life and that of my family. So how I do this research, I use big data, which we in Canada are fortunate to have, including cancer registries from all our provinces. So I look at those data to look at patterns of disease and patterns of treatment and patterns of outcome. I also do surveys. So as a patient myself and being connected to the community of other patients, I go to us and I do surveys to look at what issues are affecting us. So I just wanted hot off the press research that we've been able to publish this year. So one study that just came out in January that I'm quite passionate about. So we know that the risk of early age onset colorectal cancer is increasing. There's been so many evidence on that. What we don't know is patterns of this increase so that we could understand where we might be able to intervene. So using mapped out the incidence rates of early age onset according to year of age. And what we found is between the age of 49 and 50, it's actually where the highest risk was occurring. So there's a 19% increased risk over time. And when you think about when the age of screening starts, which in Canada is age 50, so our data suggests that we will be missing a large portion of cases that will not have been diagnosed until they would have been screened after age of 50. So we're actually hoping to use this evidence towards the debate to whether we should potentially be lowering the screening age for colorectal cancer to 45 in Canada, as had been done in the States. Another study that also we just published this year is looking at health information needs of individuals with colorectal cancer. There's actually, I think, is it a GIF right now that's happening online where, a lot of cancer research will say that, yes, information needs are unmet. But we wanted to disentangle is actually more than nuanced information. So using a survey, and we actually surveyed individuals across the age spectrum, so both early age onset and average age onset, we did find that there was a gap in information needs of early onset cancer patients. And touching on aspects of mental health and sexual health. What we did find, which was encouraging, is there is information needs when it comes to treatment. So those are being addressed, which makes sense because, when we're getting for treatment, our healthcare providers, our medical team, our oncologists, our surgeons, they are, focusing on that cancer. But I guess being focused on and what needs to still be supported is the other aspects that cancer touches on. So this is the mental health and the sexual health. So this right there is just a summary of, again, the research process. So basically you identify the problem, you look at what's been published in the scientific literature, you design a study, you collect and analyze the data, you interpret it, and you report the findings. This is the cycle that I follow in all my research studies. How this is unique for my colorectal cancer research is that I call it patient-powered research, where the problems that are identified are those that are really driven by what I see in my patient community. So I belong to many support groups like the ones run by Colon Town and Young Adult Cancer Canada. I'm also on Instagram sharing my experiences with early age onset. And this is where I find the problems that I hope through some research. So I find myself in this unique and I think privileged position to both be a researcher and a patient. And I really hope that this is an opportunity to raise awareness about this devastating disease. So with that, I thank everyone for the opportunity to share a little bit about myself and a little bit about my work. Thank you.
Thank you so much, Dr. DeVera, for sharing your patient-powered research. I like that, and your current project, as well as your personal story. So I'd like now to let each of our panelists to introduce themselves. Dilman, perhaps you can start us off.
Sure. So my name is Dilman Fournier. I am 23 years old, and I live about half an hour away from London, Ontario. I was diagnosed at the age of 19, and I am just about to finish up my last treatment here in June.
Thank you, Dilman. Thank you so much. Bryna, maybe you can continue.
Hi there. My name is Bryna Dilman, and I live in Toronto, Ontario, and I was diagnosed just about 5 months ago. So this is very new to me about colorectal cancer, about the community and the support services. So I'm really interested in learning more and how to get connected. So thank you.
Thank you. Thank you for being with us. Pierre, do you want to introduce yourself?
Hi everyone, bonjour à tous. My name is Pierre. I was diagnosed with stage 3A colon cancer less than a year ago, and I finished chemotherapy back in October. So I am just trying to figure out where to go from here, and I'm currently doing my follow-ups with my oncologists and figuring out the next steps with them.
Thank you, Pierre. And last but not least, Haydn.
Hi there, I'm Haydn. I'm 22 years old and I'm living in Ottawa, Canada. I actually was diagnosed with stage 3C colorectal cancer and subsequently Lynch syndrome, and that was in March. So I've just started my treatment now.
Thank you, Haydn. Thank you, and thank you all for being with us and having the candor to also share your experience and your story. Maybe to kickstart a bit this panel discussion, I could ask a question about, again, many early age onset colorectal cancer patients, both in the Never Too Young survey and ongoing research by Mary, share that they did not necessarily receive a lot of education or information about sexual side effects or impacts of early age onset colorectal cancer and treatment. So the question I would have for you guys is, if you have not received education information, what would have been helpful to you related to this topic? And if you have, maybe what has been the most helpful for you? Who wants to start?
I'll start. So one of the things, I'm part of the LGBTQ2+ community, which stands for lesbian, gay, bisexual, transsexuals, two-spirited community. And it was interesting speaking with my oncologist, actually just before and after surgery, what activities I could take part in, what I couldn't take part in. And for the most part, I had a right-sided hemicolectomy. Didn't really impact any activity, so to speak, but to know that I could ask the questions, I could ask the questions and my doctor was able to reply right away. Where I found there was perhaps an area for opportunity is certainly within the community itself. We often talk about STIs, STDs, so on and so forth, but there's not a lot of conversation about the LGBTQ2+ community and cancer. And it's not to take away from the STI conversations, the HIV conversations, but really add a whole new conversation about having cancer, colon cancer, as well as being gay. What does it mean? Are we getting the types of service that we should be getting? Is there anything else that we should be worried about or concerned about? So I think it is an opportunity for, at least in Canada, that we could look into, because I did some searches on internet, and I see a lot of groups in the United States, less so in Canada. So I'm hoping that we can move forward with that in the near future.
And Pierre, may I ask, to build on this, the information that you were able to get from your physician, your doctors, and get a bit that conversation going, was it more from your side, or was that information that you were able to get from the community or the healthcare professionals?
So it was questions that I had to ask. It wasn't necessarily readily available to answer your question. So there were specific questions that I had to ask. What they did ask me, and this was just before I started my chemotherapy, was around reproduction, and knowing that my chemotherapy would potentially impact my levels of fertility. So, and basically not being fertile anymore. So we had to have a conversation to see if I wanted children in the future. And being 40 years old, it was not something I was planning on. So the decision was easy. But for someone who would like to have a family, who might be impacted by their chemotherapy treatment or other types of treatment, it is something to think about, and to have those conversations with your physician and also your family members, which is not always an easy conversation to have.
Yeah, that's a great point. Thank you for sharing, Pierre. Is there anyone else who wants to add to the answer, wants to add their own comments to this?
Sure.
I could actually. Oh, sorry.
Oh, no, you can go ahead. You can go ahead.
No, you're the expert here.
Oh gosh, I'm not. No, I just wanted to, I guess, echo what Pierre mentioned. So with myself, a radiation and then the chemotherapy down the road. So I was also fortunate enough that my radiation oncologist was able to educate me about the side effects of radiation, which was going to be radiation-induced early menopause, which I went on early menopause, and subsequent loss of fertility. So I was also at the age, I just had a baby, and it was my second baby. So even though fertility preservation was brought up, it was not an issue for me because I'd already, had the babies that I had, and I wanted to focus on the treatment. But I have to say that we just have a research paper right now, because one of the things that I really wanted to go into is sexual and reproductive health, because even though I had my experience looking at my Instagram communities or Colon Town, there's a lot of women that were sharing that they weren't getting education about the fertility and the sexual health effects of for its treatment. And to me, that's devastating when, we had women potentially going to treatment not knowing that they were going to be impacted in terms of fertility, and not have that discussion was really concerning for me. So that's something that, again, I'm hoping that the research findings that we find could be used to advocate for this. And sorry, Haydn, your turn.
Sorry for
So
interrupting
Haydn,
you.
add something.
I was just going to add that, I mean, given that I'm 22 years old, I wasn't even really thinking about starting a family at this point in time. I just finished university and I was kind of just focused on what's next. And then when I got my diagnosis, from the time of my diagnosis until my treatment, it was really quick. I think it was about 3 weeks. So I was lucky enough to actually have a team of doctors that explained to me the risks involved with different treatments and the surgery that I'll probably have in the future or in the coming months, depending on how my treatment goes. But I was very quick to actually get into a fertility clinic and give a sample, just because in the future that is something I would like. And I'm really glad that my team of doctors was able to explain this to me, because I don't think everyone does know the risks involved with treatment.
Wow. Thank you for sharing that, Haydn. It's tsunami of information on top of having to make all those decisions and absorbing everything. So if you're all okay with this, maybe we can move to a little bit of a different side and talk a little bit about the emotional health. Like, a majority of participants, 75%, in fact, in the Never Too Young survey, shared a concern about their emotional health. So, Mary, I think you're currently researching the risk of anxiety and depression among individuals with colorectal cancer. So, to our panelists, I would ask, what are some of the coping mechanisms that you use to deal with treatment and impacts of colorectal cancer on your emotional health and well-being?
I can start. I'm also 41 when I was diagnosed. I live a very healthy life. I'm active. I have a young daughter. And hearing that I had cancer, I think completely took me into a very different type of mental space, and definitely, terrified, lots of anxiety, depression, couldn't sleep. I'm lucky or unlucky, I've dealt with anxiety before. So I have some coping mechanisms that I've learned through courses I've taken through cognitive behavioral therapy. However, I think that there's definitely a lot of support that, I wish that I had known or had. I mean, I would go for runs, try and do meditation, try and talk to people. I was fortunate enough that the hospital where I was treated connected me with resources for therapy. But again, I think that just trying to understand how this fits into my life, what does this mean? What do I do moving forward, and how do I deal with this on a day-to-day basis while maintaining, my family life, my work life. It's definitely taken a toll on my mental health. So I'm constantly working on it, constantly, writing down those fears and trying to, rationalize them, or be part of communities like this and figure out how other people are coping with it. And again, for me personally, exercise and meditation and moving is a huge support for me, especially during a pandemic when you can't physically be with a group of people being diagnosed and told where, I can't even hug my parents. It's been challenging in those ways, but again, just trying to find more community support and more people who have gone through it, whether it's a different experience or different age, or even a different sex, just how people are dealing with this, I think is also for me an opportunity to kind of learn to deal with that mental health aspect.
Thank you so much for sharing, Bryna. I hear a lot about the information, the need to network, but also the pace at which you need to have information, and that continuity of getting that support being critical. Yeah, and especially in a pandemic situation. So anyone else wants to contribute also to the discussion about emotional health? Yes, go ahead, Dylan.
So for me, when I was diagnosed, I was 19. So I think my biggest thing was more fear, and like for me to kind of come to terms with maybe possibly having to leave my friends and family behind. Now, once I kind of came to terms with accepting that, I was able to see that life is more about the memories that you make with your friends and family, and then I realized on just focusing on making lasting memories with them. After that, I think it was seeing that my family saw that I was finally just smiling in one of my toughest times. I think that was kind of a big relief as well. But I think about 2 years ago, when my friends and family thought that I was actually going to leave, I think was kind of the biggest turning point. Things actually did take a turn for the better at that point, and I was put on Pembro or pembrolizumab, if some people don't know that, which actually led to me not having a PICC line anymore, or I wasn't on any painkillers. And then I just started going to the gym kind of 5 days a week. And then that kind of was just a place for me to escape my reality. And for me to have a place to escape and kind of not focus on what was kind of there every day. Like I wasn't thinking about it at the gym. So it's just a nice place for me to reflect too.
Yeah, get out of everything, I guess, huh?
Yeah.
My baby is 22, Dylan. So again, hearing you, and thank you for sharing so candidly, but hearing about going to or getting to terms with some of the possible outcome and all of that, it's just like shows such an amazing resiliency into life. Just a great learning for everyone.
Thank you.
So maybe to turn to a little bit of talking a bit more now about that community that you all mentioned about the network. So I know there's many programs and many online programs right now that are available, but many individual with early age onset colorectal cancer, and I can imagine, like, again, difference of age, and you're all going through very different things, but you still feel the lack of that peer-to-peer support. So the question I would have is, how can the colorectal cancer community better really support patient and facilitate kind of that peer-to-peer connection? Any ideas of how we could improve that? How can we help that happen?
I can go. Haydn?
Yes, Pierre.
No, to me, this is the first. Oh, okay, thanks. To me, this is really the first time I've had a chance to speak with other people that are going through colorectal cancer, and it's kind of nice to hear the different stories. So obviously, more touch points like this would be wonderful, and perhaps do videos for YouTube, short series, a podcast. Could be actually quite interesting, where we each share our own story and talk about a topic, something developed maybe over the next couple of months. But I think just having a conversation and normalizing colon cancer amongst our age group, and really demystifying that it's not an old person's disease. The one thing that I noticed when I was telling people that I had been diagnosed with colon cancer is that their response was like, but you're so young. And I'm sure we've all gone through that. How could it happen? You're so young. And the idea of normalizing it will hopefully start the conversation amongst each other amongst our friends, amongst our colleagues, but more importantly, and this is what I noticed, that maybe it was my fault, I didn't know my family history with colon cancer, or perhaps other types of cancer. So to normalize those conversations, as difficult as it can be over a dinner, over a Zoom call during COVID, and hopefully over dinner face to face soon, to have those conversations, just to say, what is our family history, and that will hopefully start the conversation.
Okay. So I understand not only the community, but also how to do that, and getting that conversation, visibility, communication with also your family and your loved ones. Haydn, you wanted to say something. Do you want to add to that conversation?
Oh, yeah, just to add to Pierre, in my experience when I was diagnosed, I was put into contact with 2 social workers through the hospital, which was great, and it was great speaking to people like that. But one thing I noticed is they had lots of resources for me, but given the timeline, I mean, that was just after I was diagnosed, so there was a lot of things kind of on my mind, and I was going through a lot of things, so having 15 links sent to me via email was kind of tough. And it wasn't until through a family friend that I actually got connected with Colorectal Cancer Canada, and I joined the support group, which was great, because prior to that, the only people I had spoken to about my rectal cancer that had also gone through this were people who were usually older men in their 70s or 80s. And even though their experiences were great, and just knowing kind of what's coming, it was also hard because we're at such different points in our life and have such different experiences. So it was kind of hard because I was starting up my career and things like that. And it was also difficult because I had a partner of 6 months when I was diagnosed. So she's only 21, and I didn't know how to tell her, because I mean, it's hard for someone so young to have to deal with a partner that's going through this as well. So it was just really great connecting with younger people who also have or are going through the same thing as myself. And I think it would be great if there was more of a personal distinction almost from hospitals or from your or care team, and just someone to kind of guide you to speak to other young people or connect you to other young people, rather than having to search the internet or just pressing on random links and finding things such as this.
Yeah, thank you, Haydn. So basically having that facilitated for you to connect with also people that are going with the same age and the same experience is critical. Before we go to the Q&A, Dr. DeVera, anything to add to the discussion before we move to opening the floor to the Q&A from the audience?
I guess just to add one thing that I really like the ideas that Pierre had about, could this be like a podcast or a YouTube? Because I think one of the things about just being diagnosed young, and then as Haydn said about, there is all this stuff that's coming at you. You do need to take and internalize. So for myself, I did know that there was like support groups, say through the Cancer Society, but I wasn't ready then. So it's actually what worked for me was I joined Instagram. I just started, for the lack of a better word, stalking other colorectal cancer patients and just following their journeys and befriending them, and then started sharing my own. And then when you find that you share, you find that there's somebody else who knows exactly what it's like, and the community kind of from there. And now we still follow each other. Some of them have turned on their YouTube channels and they're sharing their experiences. So, but I think, yeah, if we could find a way to put it in a place where people could access it at different levels of readiness, because not everybody's going to be ready to share. So sometimes you just got to see what others are sharing.
Yeah, having many different tools available that you can access at your own preference, your own time. Certainly. So thank you so much for all of you for sharing so candidly your stories and being able to articulate them so clearly. This is just really humbling for me. So I will turn now to El Bohorty, who to manage the audience question. I remind you that if you want to ask a question to the panelists, you can just use your top right button called question and just capture the question, and we'll do our best to answer most of the question. Elle is the program manager at the Colorectal Cancer Canada for the Never Too Young program. So Elle, the floor is yours.
I'm seeing is that there's so many different ways in which people are getting diagnosed and getting treatment. And I think right now it feels like, you're your best advocate and, do the best you can to kind of seek out as much advice and information as possible and then follow that through. But I think, from my perspective, my doctor was very quick to send me to a colonoscopy after something that wasn't normal that I saw. But again, that was my experience. And I haven't really felt that it hasn't been for me, but I can definitely see how it's not for everyone. And I don't know if it's an unfortunate thing or not, but again, like advocating for yourself and just making sure that you create your own questions, whether that's with your family or with your own doctor or whatever support system you have, and then reach out until you kind of answer all of your own questions through all the different ways that may take you in a spin, but again, hopefully there'll be a little bit more support to be able to kind of collect all of that and see how to find it.
Absolutely.
I was
Thank
going
you.
to add, may I add something?
Yeah, absolutely.
Thanks. I was going to say that it's to design a system for a younger audience or a younger patient, sorry, or an older patient. It's not sure how we would do that, how we would manage that. There has come a time when I first had symptoms, one of my very good friends had studied, who's now a doctor, had studied gastroenterology as part of his studies, and I texted him right away and I said, listen, there was quite a bit of blood when I went to the washroom. What should I be doing at this point? And his first gut reaction was, well, maybe just a fissure or a hemorrhoid. And that was it. And he said, are you experiencing any other symptoms? And I said, well, presented just, a bit of fatigue at that point, but nothing abnormal. And he said, kind of just looked at it that way. So the system is one thing. I think that hopefully with Dr. DeVera's work, if we can push for earlier 45, but also work with the medical community, and goes back to the earlier comment of advocating for yourself and pushing that this isn't right. It doesn't feel right. I want to get more done. I think hopefully will change over time.
Absolutely. And we're working towards that slow but sure sort of culture change that comes with this advocacy work, for sure. Kind of building off that, actually, one of our sort of survey findings from the Never Too Young program was just around the fact that many patients aren't told about the fertility issues, told about the relationship issues, some of the unique challenges that come with early age onset colorectal cancer. And while we're working to change the system and have less patients falling through the gaps, in the meantime, is there anything that patients watching today could kind of take out as like a tip or a trick or maybe a question to get the conversation started? If they have upcoming appointments and they feel like those pieces haven't been touched on. Is there any questions that could get the conversation started? I know it can be kind of a scary or intimidating conversation for some people. Wondering if any of you have anything that worked well.
I don't had anything that worked well, but I also, again, was 41. I had one child, and my husband and I were kind of set on not having any more, but I was given my radiation appointments, but then I had to sign a document to say, this is going to kill your fertility. Are you okay with that? And in that moment, I was thinking, well, do I have to delay my appointment if I say that I want to continue to look at fertility? Do I have time? Do I want to? Do I want to continue just going forward because I'm scared and I want this removed and I already have my appointment set? So I think having some sort of communication to find out what happens if you do say, yes, you want to do something with your fertility. Will that delay things? I mean, for me, it's a very different situation because in the pandemic, I was nervous of postponing because of who knows what the situation was in the hospital. But for other patients, it might just be also mental health. They've given me my appointments. I want this out right away. So any sort of guidance on what does that look like? I as well have been kicked into early menopause like Mary, but actually had no communication about that. So I think even since I heard you say that I am now calling my doctor and asking more questions, something that wasn't necessarily brought up to me. So I don't know if there's like a Q&A that can be given when something like this happens to talk about those things. But I definitely think that it would be very valuable.
If I could just add in there, I think this is why being part of a community, whether it is something like Colon Town or is it like what I have an Instagram community where I follow other people that were diagnosed with young onset colorectal cancer. And it's just part of my daily thing where when I scroll, I look at what people are sharing. So for myself, every time I have an appointment, I actually post it on Instagram because it becomes my calendar and I know when I went for this because I go to my Instagram. But then it's when I find someone share something, it's like, oh, is that going to happen to me? And then that primes me to add that to my little list that when I go to my doctor, I will ask about that because somebody in my community shared about it. And often you will find that, again, when somebody shares, it really opens up to other people sharing, and you will find comments from other people that have experienced the same thing because it can really be isolating. So there's comfort in knowing that you're not alone. So I highly encourage building that community, finding us. I think all of us on this panel are on Instagram. So find us and we will be there for you.
That's
And may
amazing.
I add something to the earlier points? Is I'm wondering if there would, from the data that we've collected, would there be even differences between genders, what women are experiencing and what men are experiencing, and the types of questions they're asking? Because as a guy, I went in, no, I'm going to beat this. I had my pride with me. Now, I can't speak on behalf of a woman, and I really haven't met that many women who have encountered colorectal cancer. And I'd love to hear more about that and what are the differences between men and women, and asking your doctor those types of questions, especially around sexual reproduction or just sexual health altogether.
Absolutely. Great
I'm
point,
glad,
Pierre. Thank you.
yeah. And I'm glad you brought that up, Pierre, because I guess when I did my first research on sexual health, I was focusing on women, but I think it reflects on what I was seeing in my community. And I guess to the guys, um, I don't know. I think there's also that need to open up and share. I don't know if guys are not sharing as much as women, because that's also, again, what triggers me to ask my questions. So I'm going to start following more guys, and I'm hoping that more guys will share their concerns so that we can answer the questions that the guys are asking.
Absolutely. Well, we're running out of time, but thank you so much to all of you for attending. We have a 10-minute break coming up. And then after that, we'll have our last session of the day, which is about building a more resilient healthcare system. Thank you so much.
Thank you.